Hi Ankit sir, how are you doing?
All good, sir. Hi, sir. It's an absolute honor to be with you in the same frame.
Very nice, sir. So, guys, our first objective of this live session would be talk about how to go about giving a GT and then how to revise it. I think we should focus on micro steps for our journey towards the final goal. The destination may be seeming a little far away. That is totally understandable. But I think it is today and tomorrow that I can do is what will shape my future. So I think with that approach, जो भी मुझे लगता है, मतलब I am a strong believer of the fact that जो भी होता है अच्छे के लिए होता है. So yep, if things are working out in our favor and if the court is listening to us, then excellent. So, Ankit sir, there were a lot of queries with respect to how to go about a GT revision and like what should be how to cut down on the negatives. So I think this slide is a pertinent one and that helps us actually narrow down to those options where आती हुई चीजें भी गलत हो जाती हैं. So we'll begin with like the first yellow marking, which is like the critical one, where one has already known a topic, one has already read it from, maybe two different teachers, two different apps, and then उसके बाद भी गलत हो गया. So that is like a rank dropper. It's I would say it creates self doubt in anybody's mind. So I think one of the important reasons for it, which I personally feel, is that minor details are forgotten. But then a lot of people that I meet tend to say कि sir वो ना brain fogging हो गई. So I would like you to shed some details about ये brain fog होता क्या है sir? मतलब is it a reality or is it a myth? And अगर ये सच्चा है तो फिर इस brain fog से how do we come out of it?
Right, sir. I think indeed sometimes it happens. Sometimes, yes, we get confused, and it appears that, we have read about it and हमें लगता है कि हमें आंसर आता है, हमने कहीं पढ़ा है, but we are not able to get to that right answer. So these things, do occur, especially, when we are in a state of exam. Exam has it in itself inherent anxiety होता है, and that sometimes lead to, those confusion. So again, for that, I would say reading, revising things again and again is one of the most important and crucial steps. Many times, sir, we see that students tend to read a lot and then they're not able to assemble it and they're not able to revise it. So, especially during this, time of the exam, when the exams are approaching, one thing which I always suggest is, do multiple revision rather than reading anything new. Try to just revise which you have read multiple times so that, you are able to, have that memory in your exam. Because sometimes it happens कि एग्जाम में क्वेश्चन है तो आपको लगता है कि हाँ ये बुक में कहीं पे इस पेज पे हमने पढ़ा है, बट वो क्या पढ़ा है वो नहीं याद. सो इट्स वेरी इंपॉर्टेंट टू कीप थिंग्स फ्रॉम योर शॉर्ट टर्म मेमोरी टू लॉन्ग टर्म मेमोरी. एंड उसका एक ही, देर इज जस्ट वन थिंग विच कैन बी डन बाय दिस इज डूइंग मल्टीपल रिविजन. हमारी फैंटेसी होती है कि बुक को पिलो के नीचे रखो और सब कुछ याद हो जाए, बट उससे चीज़ें लॉन्ग टर्म मेमोरी में नहीं जाती. वन एंड वन ओनली थिंग to do that is to revise multiple times. So I think that is very important in this phase of the preparation.
मैंने एक स्टडी पढ़ी थी उसमें लिखा था कि शॉर्ट टर्म मेमोरी को लॉन्ग टर्म मेमोरी में कन्वर्ट करने के लिए रिवीजन 3 टाइम्स करना चाहिए, कोई भी चीज 3 बार पढ़नी चाहिए. आई एम नॉट श्योर हाउ एक्यूरेट दैट इज, बट आई थिंक वो तो अब तो आई थिंक अचीवेबल हो जाएगा, नहीं है ना? मतलब
Right.
अभी मे बी हम एक बार रिवीजन नहीं किया, कोई बात नहीं. अभी जो भी हो रहा है उसकी वजह से मे बी वी माइट बी एबल टू पुल ऑफ एंड डू मल्टीपल रिवीजन, राइट? सो दैट विल गिव अस मोर कैपेबिलिटी. सर कोई दवाई नहीं है?
नहीं सर, आई होप होती.
कोई सा
बट
नू
मेरी,
टॉपिक एजेंट ऐसा जो कि मतलब शॉर्ट टर्म मेमोरी को लॉन्ग टर्म मेमोरी में कन्वर्ट कर दे?
so let's hope the future, doctors were seeing us, maybe they go in the research and maybe they only make such a medicine, and that will be a boost to all of us, I think.
सर आपके पास तो क्वेरीज आती होंगी ना कि नींद को भगाने के लिए क्या करें. मतलब देयर आर 2 टाइप्स, राइट? एक तो होता है मतलब मेरे जैसे जिनको बहुत नींद आती है, और कई ऐसे होते हैं जिनको नींद ही नहीं आती. तो मतलब क्या करें सर एग्जाम से पहले ना? मतलब आई मीन इट हर किसी का आई थिंक एमिगडाला एंड हर किसी का जो मतलब जो रिएक्शन वाला फीचर है वो डिफरेंट होता है, तो वो रीसेट नहीं हो पाता सर. सो आप मतलब वन ऑफ द इम्पोर्टेंट रीजन, लाइक यू आर अ माइंड टीचर, सो आई वांटेड टू नो कैसे करे सर, ये अमीगडाला कंट्रोल में ही नहीं रहता.
Sir, again, I think some level of anxiety, though, I think is good. In fact, we read about it, in that curve, bell-shaped curve, that some level of anxiety is very important. That increases our performance. But as you rightly said, sir, कि अगर anxiety becomes, overwhelming, तो फिर performance, it dips. So again, again, keeping the nerves very, cool is very important during this phase of the preparation. So again, having a fixed, schedule, as you said, sir, sleep is a very important challenge. Students say कि नींद आ रही है, some students say नींद नहीं आ रही है. So keeping a fixed duration or keeping a fixed time of sleep during this time of your preparation is very important. कि अपना सोने का टाइम और अपने उठने का टाइम फिक्स रखो. ट्राई टू डू थिंग्स रेगुलरली. ट्राई टू मेक अ शेड्यूल कि आप डेली जो भी एक्टिविटीज आपको करनी है, कैसे पढ़ाई करनी है, मेक अ फिक्स शेड्यूल एंड ट्राई टू फॉलो इट. तो स्लीप में वेरी इंपॉर्टेंट इज टू हैव अ फिक्स्ड schedule for sleeping time. ऐसा ना हो कि sometime we are sleeping at 1 o'clock in the night and sometime we are sleeping 11 o'clock. So it should be a fixed time.
बट मोस्ट पीपल टेंड टू स्टडी द होल नाइट. मतलब एक इंप्रेशन होता है, मैं अपने दिनों की बात कर रहा हूँ, तो मुझे ऐसा लगता था कि रात को पढ़ रहे हैं तो बहुत ज्यादा मेहनत हो रही है, दिन में कम पढ़ते थे. एंड बिकॉज आई वाज स्टडिंग मोर एट नाइट, तो डे में वो परफॉर्मेंस लाइक एग्जाम में नींद आ रही थी एंड आई वाज नॉट एबल टू परफॉर्म ऑप्टिमली. तो आई थिंक वो यूनिवर्सली इतने सालों से आई बीन टॉकिंग टू स्टूडेंट्स एंड आपने भी इतने साल से देखा ही है. तो आई थिंक व्हाट जो मिस्टेक्स हमने करी वो हम यही बोल सकते हैं सीनियर्स की, भाई मत करो, कि ट्राई टू चेंज योर सर्कैडियन रिदम and you should be maximum alert in the morning hours as compared to max alertness at night. Because होता यही है कि सारा दिन मतलब सुबह हम सारी रात पढ़ने के बाद हम दोपहर को 2 बजे 3 बजे अगर कोई जाग रहा है तो then his performance would automatically go down. So yes sir, very pertinent point. Brain fog is something जो हमें minimize करना है. Then is like long options, right? तो मुझे लगता है कि we should be doing more practice on the number of questions which are having long options, because they are the ones which are critical, because उसी में वो वर्ड्स छुपे हुए होते हैं, राइट? Like there's one example from last time NEET PG which was atrial fibrillation and it was a standard question. I mean everybody is gonna thinking कि यार बीटा ब्लॉकर ही होगा, but then it was beta blocker was contraindicated in that question. So it was because the patient was having acute pulmonary edema and beta blockers नहीं देते हैं, मतलब in a patient who's having acute pulmonary edema. So the answer turned out to be digoxin, which is very very peculiar. तो I think उसका solution जो है in my opinion would be that one should be noting down such minor points in a separate register, because वो notes में जाके if you try to add, it will add up to the unnecessary burden, right? I mean, if you are trying to then turn the pages in your notes, adding there, then you may not be able to remember, because see the topic you have read multiple times, but वो छोटा सा minor detail if you've forgotten, then I think that you can post that at a place which is much more revisable. I think that's the only way forward, and वो list बढ़ती जाएगी धीरे धीरे. But I think if in your own handwriting you are gonna note down that point, then on the next day if you read it, and that I mean, suppose like if I'm saying that if I have suppose the paper is on 15th only, right? So I would be giving max number of GTs जो मेरी physical ताकत है. I could be doing every alternate day, I could be doing every third day, I could be doing every fourth day, but I need to push it up, and I need to think that okay man, bring it on वाली बात है कि whenever is the exam, right? Like our soldiers, right? They prepared for so many days before Modi ji gave the final order कि भाई जाओ, right? So we need to be in the same mode, planning, logistics, so that we hit and we hit very precisely and we hit at the correct moment, and so that we are able to win the war. Like if I obviously the sacrifices that those guys make is much more than what we guys would be doing in a civilian life. I mean, but still taking inspiration from them, that they kept their cool, they kept quiet, and then they planned. Logistics were one of the keys, right? We were not beating our chest, we were like planning logistic, we were quiet, and then when the signal was given, we went ahead. Same is the scenario, whether it's 15th, whether it is 30th, whether it is 1 month, whenever it is, right? I have to be in that battle ready mode, and I'm gonna say, okay man, you tell me what time is it, what date it is, I'm gonna be showing up for that fight, right? So I think that is the attitude that we are trying to inculcate, that is what we're trying to prep you up for. And I think for the first part, like what we knew and what went wrong, I think there are four primary reasons. That is, one is forgetting the minor details, that has to be minimized with practice. Skipping, lots of us skip those minor details, right? I mean, when you're reading that information, we हमारा दिमाग कहीं और होता है और हम पैसिवली उसको पढ़ रहे होते हैं. तो अगर आप 1 घंटा पढ़ते हो तो अभी 1 घंटा में 1 घंटे का कंसंट्रेशन रखना है. इट कांट बी कि 1 घंटा पढ़ा और आधे घंटे का आउटपुट आ रहा है, बिकॉज दैट इज व्हाट हैपेंस विद मोस्ट पीपल. नाउ व्हेन यू विल लिसन टू सो मेनी न्यूज एंड सो मेनी सोशल मीडिया फीड्स, ऑब्वियस बात है कि दिमाग और ज्यादा डिस्ट्रैक्ट होता है. सो मेरा सजेशन यही है कि लाइक यू नीड टू टेक अ टाइम ऑफ लाइक 1-2 आवर्स. तो हर कोई मतलब एवरीबॉडी इज बाउंड टू फील इमोशनली ओवरवेल्म्ड, बट उसके बाद में यार यू नीड टू गेट बैक टू व्हाट यू डू बेस्ट, एंड व्हाट यू डू बेस्ट ऑन अ रेगुलर बेसिस that you do questions, you practice your theory component, and you need to ensure that your reading part, what जो भी पढ़ रहे हो दिमाग में जाना चाहिए. इट इज नॉट कि एक ही पन्ने पे 2 घंटे से बैठे. अंकित सर, ऐसा होता है ना बहुत बारी कि हम एक ही पेज को 2 घंटे पे पढ़ रहे होते हैं, एंड लाइक वी टेंड टू गेट स्टक एट दैट पेज. Is there any दवाई for it? That's the shortcut. I'm gonna ask you again and again. And second, like इसको ओवरकम कैसे करें सर? ये मतलब सबके साथ है ये प्रॉब्लम कि मतलब एक 3 पेज पढ़ेंगे तब लगेगा वाओ यार बहुत फास्ट कर लिया, लाइक 30 मिनट्स में 3 पेज डिटेल में पढ़ लिए. 6 pages, 3 pages I'm saying, like front and back, 6 pages in, like one maybe 2 topics finished, and then it's like I'm stuck at 1 page. तो इसका solution बताओ सर.
Sir, again, so no medicine, unfortunately for this as well. But yes, sir, rightly, as told by you, this happens to all of us. So first of all, we need to understand it's very natural. It's a normal human tendency. Sometimes it happens. We get exhausted and we tend to take more time. So first of all, we need to be, don't be harsh on yourself that nahi ho pa raha. Don't compare your yesterday. Sometimes sir, we do is ki kal to bahut achhi padhai hui thi. Now my speed is a bit less. So don't compare your studies with the past day. Take one day at a time. Few tricks and tips to handle that is sometimes when you feel that you're stuck, so maybe you're reading theory too much. What you can do is you can go to MCQ. So you can just practice some MCQs so that again you are back to that same rhythm. Also sometimes what happens is we get bogged with one subject. So what we can do is we can keep another option. Maybe when I am reading a vast subject like
इसमें
medicine.
सर मेरा एक पॉइंट है कि जब वो
Right.
सब्जेक्ट खत्म नहीं होता ना, तो उसमें स्ट्रेस और ज्यादा
Right.
बढ़ता है. मतलब आई बीन थ्रू दिस, यू बीन थ्रू दिस, एंड इवन दिस बॉयज आर गोइंग थ्रू द सेम
Right.
थिंग. कि जब वो माइंड में रहता नहीं कि सर्जरी खत्म नहीं हुई, मेडिसिन खत्म नहीं हुई, ओबीजी बड़ा वाला सब्जेक्ट पेंडिंग में है. होता क्या है, हम इनको लाइक मैं भी यही करता था कि मेरे से जब नहीं होता था तो आई यूज्ड टू टेक अप अ शॉर्टर सब्जेक्ट. लेकिन मुझे लगता है कहीं ना कहीं वो एस्केप है, अगर आपकी भाषा में बोलूँ एस्केप मैकेनिज्म ये है कि हम ना वो उसमें चले जाते हैं कि चल यार हल्का सब्जेक्ट कर लेते हैं, लेकिन वो फिर इट्स लाइक अ गॉडडैम मंकी ऑन माय बैक. तो मतलब आई वांट टू शेक ऑफ दैट मंकी ऑन माय बैक. फिर मैंने सोचा कि यार बहुत हो गया, मतलब अब तो इसको ना खत्म करके ही छोड़ना है, चाहे रात को बैठना पड़े 1-2 घंटे जब बहुत ज्यादा नींद आ रही होती है. बट देन आई थिंक लाइक यू आर राइट इन दिस दैट वी नीड टू डी स्ट्रेस अ बिट. बट वो रहता है सर, आई आई बीन थ्रू दैट कि इन द बैक ऑफ माई माइंड आई एम ऑलवेज थिंकिंग यार इतने बड़े बड़े ये वाले सब्जेक्ट तो मैंने करे नहीं है. और
Right.
लाइक even if I've done them once or twice, I'm still thinking यार ये बचा हुआ है. तो my
Right.
suggestion at this point is थोड़ा सा हार्डकोर होना है guys, हार्डकोर होके ना just get the goddamn monkey off your back. तो
Right.
I think उसको आगे आगे we can go ahead with this. एंड सर थोड़ा सा रीडिंग एक्यूरेसी भी बताइए ना, कि मतलब लाइक ऑप्शंस आर वेरी क्लोजली वर्डेड, लाइक
True, sir.
सो उसमें कोई ऐसा माइंड ट्रिक है हमारे पास में कि हम अपना फोकस जो है ना वो बढ़ा पाए. देखो ऑल ऑफ दीज बॉयज एंड गर्ल्स आर वेरी सुपर इंटेलिजेंट, 2 ऑप्शन तो ये रूल आउट कर लेते हैं. अब बिटवीन द रिमेनिंग 2 ऑप्शंस वो वर्डिंग का ही सारा खेल होता है, वहां पे वो कई बार आईज गो टू द राइट आंसर एंड आईज गो टू द रॉन्ग आंसर. सो
Right, sir.
माइंड ट्रेनिंग दैट इज लाइक सजेस्टेड while doing questions, like how to I mean optimize your answers to a particular question.
Sir, again, this I would suggest is when you're reading the first time, read it very seriously. Don't read it casually. Read the question. Try to identify keywords. Sir, many times we miss some of the keywords. Like psychiatry, if I say, na, if I change the duration, diagnosis will change. So duration would be a very important word. Sometimes they just mention few days or few weeks. So that is the duration, which if I read casually, I may miss out on those things. So reading the question carefully, and also, sir, sometimes it happens that when I'm reading the question, na, there is some answer in my mind. And when I am reading the options, I'm trying to search that answer. But sometimes we may have a better option as well. So try to first read all the options, then try to think of the answer. So this is again very important because sometimes the examiner are very clever these days. They will twist the options that what you are thinking may not be the right answer. So there may be a better answer. So it's very important to read all the options carefully. Then, as you said, that rule out some of the options. And then again very important is we always say follow your instincts, follow your guts. Sometimes the first answer which I'm thinking usually is the right answer. So then you may go with that as well. Don't try to overthink when you're answering a question. This is one important suggestion which I'll suggest, sir.
Yeah. And Dr. Sabra, yeah, I think you were right that you're not able to study before 2 p.m. But then I think it's high time that the circadian rhythm has to be changed. So try doing it in bits, and I think you will be successful in another week or so. I think it's important that we have to have our max performance in the morning hours when the exam is conducted. And just to follow up with what Sir said, like last time in NEET PG, there was a question on von Willebrand disease, that is type 2M and type 2N. And you'll notice that, one is having problems with binding with platelets, and the second one is having defective binding with factor 8, and वो उल्टा हो जाता है, right? I mean, in our mind we can go ulta about it. So होता क्या है कि because we are so overwhelmed with the data, like these kind of questions have a high probability going wrong. But I think that that's a blessing in disguise. So, in the exam, there will always be some very nasty ones which are very close, because see, remembering von Willebrand disease itself is a big deal, right? So remember the subtypes of it, and then remember, okay, that 2M में क्या होता है, 2N में क्या होता है, and then the data can be reversed by the examiner, and that can cause a bit of errors of judgment. So I think that is okay. I mean, we can take like about 5% of the paper is gonna be like that also. And then at the same time, there's gonna be some, like, the green flags, I can say, where we are gonna be saying, okay, man, I killed it. And we don't need to feel overconfident about it, because that everybody else is scoring as well. So I think the yellow part of the slide is the most important part of this particular discussion that we are doing. That whatever we know, and whatever we know, we need to deliver the output on that. And for that, it is like, what I cannot control what happened yesterday, right? I cannot control what will happen in future. I can just control what will happen today. So it is just that I'll keep my focus on my books, and that is the that's one of the main objectives of the session. I mean, we need to keep our amygdala's reaction under check. We need to keep our serotonin levels balanced, right? Minimize dopamine hits that we take from the various multiple sources that you guys anybody know, and I don't need to talk about them. I mean, I think that dopamine hits the result in this neuro imbalance, which results in, various kinds of reaction that occurs in people. So over a period of time, I think most of you are like fighters. Most of you are like, you have been through medical school, you've been through the grind, and all of you were like brilliant people in like class 10th and 12th, and A level students. And then when we go into medical college, then everybody is A level. So we start doubting ourselves, because then everybody is so talented now that we tend to get a little bogged down. But guys, I just want you to awaken that beast in you, that the capability that you have. Remember, when you were in class 10th and 12th, you were like that, that A level of high performing student, high performing guy or a girl who had the capacity to sit through the whole night and push it off. Now, because of 5 years, you've been doing it. What happens is that a bit of mental fatigue comes in, a bit of, I would say, a saturation comes in, and that is why we tend to self-doubt ourselves. But I just want to tell you that this is the time where you can just reignite that passion, you can reignite that beast in you, and you can go ahead and I mean, make utilize whatever opportunities God has decided. I mean, we can't control what destiny has for us. What we can do is whatever is in front of us, that is the analysis that would be very, very important. Now, what we'll do is a quick, just for distraction's sake, what I want to do is we move on to the next slide, and we focus on a question which I want you guys to quickly comment in the chat box. Everybody who's listening, whether you have read about idiopathic pulmonary fibrosis or not. And I think you would be aware of fact that Zakir Hussain Saab, one of the leading tabla player that India had, we lost him to idiopathic pulmonary fibrosis. Zakir Hussain sir died because of IPF in New York, pending a lung transplantation. And it's a very nasty disease to have. So like, what would be the leading cause of death in idiopathic pulmonary fibrosis? And I think I'm getting very good leads in the answers as well. And this is just to tell you that, you see, one of the things, because this is a recap, so I think it would be easier for you. But when I was talking to students who actually sat for the paper, they said, sir, idiopathic pulmonary fibrosis mein hypoxia hoga, and hypoxia से pulmonary artery का vasoconstriction होगा, and then it will cause pulmonary artery hypertension. अब वो क्या है, वो overthinking है, क्योंकि जब आप बोल रहे हो hypoxia होगा, तो सबसे पहले तो hypoxia would be contributing to type 1 respiratory failure, so person will not be able to breathe. The secondary thing that will happen will be a pulmonary artery hypertension. So I agree to the fact that idiopathic pulmonary fibrosis is going to contribute to development of PAH, but that is not the overall most common cause of death. Now, I got like a lot of answers which are correct here, respiratory failure, because this is the recap question. So the strike rate will automatically improve. But suppose this was a question that, like, imagine you are like you go back in the time machine and you are setting for this question 1 year ago, then you will notice that, pulmonary artery hypertension. So if you go A, I mean, excellent. I love your reflexes. If you got D, you don't need to feel bad about it. I just want to tell you that yes, you have to think logically, but first you have to think of common things as well. I think that personally, one-liners are more dangerous as compared to, doing these clinical STEM questions or long STEM questions. Sir, what is your take? Because I think you can also comment on that question that came last time on a patient having delirium tremens and there was hypoglycemia also present. So should we treat hypoglycemia? I think the blood sugar was, I think 50s only or 45 only. And everybody was very vocal about the fact that hypoglycemia tha, hypoglycemia tha. So sir, can you just shed a few words about that? I mean, because delirium tremens har bar aayega, right? I mean, they
Right,
will
sir.
change the wordings of the question. They'll just change the language of the question. So I think that if you can just quickly comment regarding that question also, sir, that came last time, that would give the viewers a bit of insight into how to approach these questions where like two illnesses are there and you are selecting kaun sa pehle treat karu, kaun sa baad mein karu.
Right, sir. Indeed, yes, sir. When you were discussing this question, it took me back to my medicine days in the MBBS. So it was so beautifully you were explaining. So as you said, I would also say the same thing. Is yes, when you have more information in the question, clinical question, we tend to think that these are difficult, but they will carry more information. The examiner is giving you more and more information, and the chances of you getting to the right answer would be more. So don't think that the clinical question or larger questions they will be difficult. In fact, the examiner would tend to give you lots of information, and that would in fact help you to get to a better answer, to the right answer. So yes, try to read those keywords and you will be able to solve those long questions, clinical question. And as you rightly said, sir, yes, we've been discussing, again, they tend to confuse between delirium tremens, Wernicke's encephalopathy. And shortly, we are seeing questions from this topic coming again and again. So try to read all the information and then try to see what are the options. Because sir, sometimes what they do is like in delirium tremens, one option they will give you is lorazepam, but if you look carefully in the fourth option, they may give lorazepam plus thiamine. That will be a better answer. So again, very important to read the options carefully and then come to the answer. Sometimes, sir, we do it opposite. We just have one answer in mind and we try to just search it in the option. As soon as we get that, option, and we mark it and we move ahead. So, I always say give respect. You are given 4 options. Pay respect to all the options and read them carefully and then mark the right answer.
सर हैक बता दो, 1 मिनट हैक कि इसको सॉल्व कैसे करना है। देखो इस पे आना तो आना ही है। अब आप
Sir,
बता दो
right,
टीटी वर्सेस वर्निकेस एंसेफेलोपैथी, राइट? ये दो के बीच में ना, मतलब
right,
गोवा वाला तो ठीक है, मतलब वो वर्कआउट कर लेंगे हम,
right,
राइट? बट वो
right,
कहीं
sir.
कहीं पे जब वो उसको स्टूपर में ले जाता है, कोमा की तरफ
Right, sir.
जाता है, फिर कैसे करना है सर, वो सोल्यूशन बता दो।
Sir, again, when we say delirium tremens versus Wernicke's encephalopathy, very important is in delirium tremens, they will give you a history of withdrawal. They will say that the patient has stopped taking alcohol. And again, sir, very important point which is similarly seen in both is confusion. So confusion is, symptom which is seen in both. Even in Wernicke's, we know the mnemonic is Goa. So there is global confusion. And in delirium tremens also, we know the patient is in a state of delirium. So there will be, they'll mention that there is altered sensorium or the person is confused. So that is again one of the symptom which is seen in both. So they will give you a history of withdrawal. That patient has stopped taking alcohol and then he has presented to us with symptoms. And in delirium tremens, they'll also give us symptoms or other symptoms of withdrawals. For example, they'll mention patient is having tremors, patient is having hallucinations, or patient has developed seizures. So such symptoms they'll also mention. While in Wernicke's encephalopathy, they may not mention that patient is in a withdrawal state. Patient is continuously taking alcohol and he has presented to us with global confusion, with ophthalmoplegia, very important, ataxia. So these other symptoms of Wernicke's encephalopathy again will help us to reach to a diagnosis of Wernicke's encephalopathy. And again, coming to the treatments, sir, as we know, in the treatment of delirium tremens, it's a withdrawal state. So benzodiazepine would be the drug of choice. But if they mention benzodiazepine plus thiamine, that will be a better answer. While in Wernicke's, of course, we'll give thiamine.
ओके सर, ओ ब्लड शुगर वाला हमेशा डालते ही है, तो शुगर तो बाद में ही देंगे, मतलब पहले नहीं देंगे, राइट
Ah,
सर?
sir, again, thiamine followed by sugar. That was the answer. NEET PG, I think the question you're talking about. Yes, sir.
ओके ओके। तो वही है सर, वो हाइपोग्लाइसीमिया वाला उसने कंपोनेंट डाल दिया था आई थिंक लास्ट
Right.
टाइम, जिसकी वजह से पीपल वर वेरी डिस्टर्ब्ड ऑफ द फैक्ट कि मतलब चाहते क्या हो। तो आई एग्री सर, आई मीन दिस बिकम्स, क्योंकि अभी क्या है क्योंकि अभी तो पुराना हो गया ना क्वेश्चन, तो इट इज इजियर
Right.
फॉर अस टू लाइक से दिस। बट वहां तो स्प्लिट सेकंड है सर, जैसे
True,
बेचारे
sir.
पायलट को डिसीजन लेना होता है 5 सेकंड के अंदर कि मिसाइल फायर करनी है या नहीं करनी है, वैसे ही आवर बॉयज ऑल्सो हैव टू गो थ्रू द सेम थिंग, और पूरा कैरियर उसके ऊपर डिपेंडेंट है। वो 5 सेकंड्स की जो फायर है, right, that
Right,
is
sir.
to press on the button, and that is the time when like whether it's a miss hit or whether it's going to be a direct hit, you never know. So that is what we basically want to minimize. So, guys, it's a very fruitful discussion, and once we are able to, pull off a couple of these aspects which are very closely worded, और वही practice ही यही करनी है यार, यही तो time है, right? When you are like, because now this time, guys, I want to tell you that you are at the peak of your knowledge. Because you are knowing all the 19 subjects. Like sir is knowing one particular subject, I am knowing one particular subject. We are not knowing all the 19 subjects, unlike you guys who are having knowledge of all of them. So I want you to realize that you are already in a beast mode and you are already pumping yourself for glory. So it is just that you need to, calm down your, as I say again, amygdala, ensure that your serotonin levels are perfectly fine and you're able to optimize your performance and get your eyes locked on to the right target. See, nobody can teach you how to get your eyes to the correct answer, but it comes with practice. I think that is what I have seen. And I have talked to so many students now that have been teaching for so many years. They ultimately tell me, that I just knew that this is probably the more correct answer as compared to the second one in those closely worded ones. So I asked him, कि तू कैसे तू guess कर लिया? मतलब like sometimes it is a very demanding, I would say, topic and a very, very technically challenging statements. But he said, कि नहीं sir, I just knew at the back of my mind, not that gut feeling. He said, I just knew at the back of my mind that this is because gut को तो डायरिया भी हो सकता है, पर माइंड जो है ना वो हमेशा एक सही डायरेक्शन देता है. Since you are a mind teacher, तो you can say more about this. But yeah, I think our eyes go to the correct answer and we should not be changing any answers in the subsequent part. आजकल तो वैसे भी सर टाइम ही नहीं होता. I think earlier time papers were really shorter, so people still had the luxury of trying to change an answer. But at the moment, I think with the kind of long options that they give, even if it's one liner, I mean it's almost close to impossible to change answers to questions. So that would be my opinion on the say, sir. Like yes. I mean, A is the correct answer, guys. Guys, answer is A, respiratory failure to the question that came up for idiopathic pulmonary fibrosis. And as I explained, I mean, Pandit Zakir Hussain sir, the renowned tabla player of India. Like normally musicians of India do not get the kind of fame that Western musicians would be getting, because we have so much of talent and so much of abundant music history. But like this did not even hit the mainstream media. I was shocked, like, we are losing such a great music player and nobody really batted an eyelid about it. And especially the disease is really nasty, idiopathic pulmonary fibrosis. So yes, guys, I think I should have commented about the answer in first only. But yeah, somebody also commented about delirium tremens presenting after 48 hours. Sir, is that a correct statement? Like, can we use time frame? Because I think, I mean, you would be the better way to tell about DT's presentation, sir. Like, would it be after 48 hours only?
Generally, we say up to 72 hours. Usually, we get delirium tremens. Peak, if you say, generally we say it is from 48 to 72 hours. But it is not that delirium cannot occur on day one. So this is again very important, that it would not be the duration that would help us to reach to the diagnosis. So suppose if they say a patient in alcohol withdrawal state comes to us with tremors, hallucinations and confusion, altered sensorium on day one. So when you read day one, you're thinking that delirium tremens might not be the answer. Delirium tremens can also occur at day one. So it is generally, we say it is in the first 3 days, but sometimes even after that also it is it can occur. So it is the symptoms which will help us to the diagnosis, not the duration. Yes, so this is again very important. But yes, sometimes they've asked that what is the duration of delirium tremens. Usually we say it is, the withdrawal state, if it is continuing till 72 hours, then more chances of delirium tremens. But it can occur also on day one. Very important.
And another thing, guys, which I would like to add up is that as when you are giving GTs, you have to attempt at least 180 plus questions, right? I was talking to a lot of people in my group who mentioned that they're doing like 170s, 175, like that. So I think that is like a under attempting approach. I think 180 plus has to be there, because even if you talk to people who cleared last time, or if you talk to people who have got through the INI-CET, which was conducted recently, I think going beyond 180 is always advisable, because you see, I understand that you want to be conservative and you want to minimize on the negatives, but at the same time, being over cautious would also try to drag down the final score. So it's important that one has to take a calculated risk. And like I said, I gave example like our soldiers, they were preparing for so long, they were totally quiet. When the message came that they have to attack, they went into a battle mode, right? So I would suggest everybody to follow the same thing, whether the exam happens on 10th of June, whether it is 15th of June, whether 30th of June, or whatever it is. I want you guys to be like battle mode ready. Ke subah utھ ke, like, okay, man, we're gonna go for it. So I think it takes a while for any news to sink in, but then subsequently, once we are able to pull ourselves off and we get into that battle mode, it is very much doable. Sir, your inputs about the subsequent few slides, and we can move on there.
So, sir, in fact, yes, this is one order which came today only, that Supreme Court has ordered that NEET PG. Earlier, it was planned to be done in single two shifts. Now it is to be conducted in single shift. So this is, I think, one of the important news of the day, which all of us are hearing on social media as well. So in a way, sir, I would say this is good news. This is something which all of us were also advocating, that again, as Supreme Court also mentioned, that it gives a equal play field to every student. So it's in fairness and for transparency. And again, as they also mentioned, its difficulty level cannot be equal in two shifts. Something which we also saw last in the last exam as well. So this is something, I think all of us would agree that it is in a way a good news, that finally it is being conducted, as they have said Supreme Court, it is to be conducted in a single shift. But again, with this, there is some sort of uncertainties. Again, NEET PG is something, sir, one exam. I'm seeing that it is, again and again full of uncertainties. Even last year also, there were some changes, it was in fact just a day before the exam, it was postponed. So again, nearing the exam, there are certain uncertainties. Again, emotions, we have talked to some students, messages have come. So there are again mixed emotion. All of us would agree that all of us are in a way happy that it is finally occurring in single shift. But again, there are certain concerns also, about when, as you have also mentioned, when it will be conducted. So again, the way forward. So again, very important, sir, what do we do now? So what would be your suggestion? So what is the way forward? So a student who is preparing, thinking for the exam. So what is now the way forward?
I think it gives me more opportunity to practice on my questions and focus on my weaknesses. See, my strong subjects are anyway strong, but those subjects which tend to decrease my performance, I'll try to, that give me this window. Like if I put it like this, window of opportunity, right? So life always gives us those short windows of opportunities when we are able to pull ourselves to optimize our performance. And there is always some small micro topics, right? Not the whole subject can be bad. It is small micro topics which can be bad. It could be anything, right? It could be nucleic acids in biochemistry. It could be parasitology in microbiology. It could be ECG in medicine. It could be maybe instruments in surgery. I mean, depends, right? So everybody has their own weak links, and everybody knows deep down whatever they think is their sore point, and that sore points have to be made much more average. So I think like earlier the notion was like, they used to say COVID time flatten the curve. I'll say the reverse part, that try to uplift the curve of those subjects or micro topics which tend to drag down the score, because all of you nowadays have access to so many apps and analytics and everything. So finally, it would still let me know which are my three weakest ones. And I think those three weakest ones, they'll keep on changing also after every GT. I mean, the weak variance will obviously vary. But if I've given, like, suppose three grand tests, right, in the next 1 week, then at the end of the three, there will always be like one or two subjects which will always be highlighting among those top three, right? I mean, I agree that every GT, the weak subject can vary, but then there would be at least two out of those three, four subjects that will keep on repeating. And those are the ones that I need to basically focus on. So I think bring it on is an apt statement, the way forward, and just try to minimize. I mean, it's very easy to say do only PYQs and PYTs, but then I think just doing them and getting into false sense of security is not a very good idea. And try to go ahead and try to focus on all those nasty life cycles, and the nasty technical aspects would always be a good idea to be. Resources are so many, guys. I don't need to, reiterate. You can use RR, you can use LRR. There's so many ones that you can use. I mean, you are the best judge, whatever that you suit and whichever teacher style that suits you the best. But you have to, I'll say, take the bull by the horns and go all guns blazing as far as those micro topics that are weak have to be handled. That would be my take on this.
Right, sir. In fact, very well put, sir. Very important to focus on those areas, which are weak, and strengthening them is very important. And also, sir, I would, also like to tell the students to relax. Sometimes when such uncertainties come, we tend to waste our time. What may happen in the next few days? We may be, again searching and scribbling on the social media. Any news has come or not. So this is one very important point which I want to highlight. Do things which are under your control. So again, sir, studying is the thing which is under our control, and that is the thing which we should focus on. And even if you are, again uncertain about what is happening next, what you can do is in the evening, maybe just 5 minutes, you can just search on the media, or you can just search on some of the platform and see if there is any verdict or any change has occurred. I would not suggest you to, again, what will happen in the next few days, many of us might be just every hour, every half an hour, we'll be just scrolling through the social media thinking that some news has come or not. So again, this is a waste of time. Don't do any of such thing. Try to continue with this rhythm, because what we have seen, sir, that if such things occur na, some students, their rhythm continues and they improve, and some students momentum, it may decrease. So it's very important to continue with that momentum, the momentum you have gained. This is the last leg of the exam. It's very important to maintain this momentum.
Right, sir.
So I think, sir, with this, we would also like to come to this, sir, 51
Yeah.
topics. I would
Yeah, guys, this is the favorite part of mine. Like, I love to talk about those topics that are usually asked in the exam. These are like 51 topics that usually come in NEET PG and FMG exams, especially from the medicine perspective. So just going through them, you'll notice some of the data is repetitive as well. But I think like if you just scroll through this list, it would be a good idea to, you can take a picture of this, guys, if you want. There are only 3 slides that will be showing you. But I think that these are like very common topics which are asked. So it would just take maybe like 50 minutes of your time to go through each one of those, at least just read the list, right? I'm saying 50 minutes would be too much. Like a lot of people might be spending 50 seconds on it in a PDF and just moving on. But if you read through the list, you will get an idea regarding what are the topics that you know and what you are not aware of, right? So at least at the end of, like, let me say this slide, maybe next 30 seconds, if you can figure out, okay, 2 topics, 3 topics, 4, whichever, right, that you not read about. I'm not saying read them from a scratch, right? But then most of the time, the kind of information that we try to provide, at least in rapid revision or LLR, is very crisp and precise and to the point. So I think that investing 15 minutes into reading about, let me say, arrhythmogenic right ventricular dysplasia would not contribute to too much of issues. Or let me say, if I have to read about comparison of JVP findings or tamponade versus constrictive pericarditis, pretty straightforward ones, right? But still, there can be errors of judgment at the end. So just scrolling through the slide gives me an insight into what I assume I know, and at the same time, that topic I may not have studied well. So, I mean, I'll not get into the specifics of the topics. If you want a PDF of this, most welcome. Just drop me a mail at marwamedicine@gmail.com, and I'll send you the list of the topics. That's not a big deal, or you can just make a quick photograph of the same and just go through it by yourself. Like, for example, guys, targeted temperature management and return of spontaneous circulation that you're noticing at point number 8. Right. So, I mean, we all read about therapeutic hypothermia, but then you need to remember the therapeutic hypothermia is going to be both cardioprotective as well as neuroprotective. So, I mean, just going through that would give you a bit of, I would say, edge over others. I mean, I understand that trying to finish some bigger subjects will always take a toll, but in the end, what that matters is the description. Anyway, like, also what I want to say is that these topics, they are pinned in the description of the video, so you can download this list even from the description of the video as well. So I mean, that's much more easier for you guys. In the description of the video, if you scroll down, that's where the topics are pinned and you can go through that. So that would make you feel like, okay, if you know these, you are gonna be like, okay, man, I got it covered. And there could be some which are like, okay, I need to work on these. So at least this gives you a bit of a roadmap regarding doing one subject at least, which takes a chunk of your time. So can we move on to the next slide, please?
Sure, sir.
Right. Guys, when it comes to GI, I mean, you'll notice there's a repetition for celiac screw twice, but that's one is for celiac screw, another is for topical screw. So there's a small typo. But then you see, like I would not suggest you to do GI from medicine. I would like you to do GI from surgery. And then subsequently, like, when you turning the pages in medicine, if you find something extra, you can add them to the surgery notes. Similarly, for hematology, like I would suggest you to do pathology very thoroughly. And then the treatment part is you can add up from medicine or you can add it from pharmacology. So like 2 units are already, I would say that they can be solved from other subjects as well. But then there are some very pertinent topics like endocrine and, I mean, I'll say like this: cardio, neuro, respi, and endocrine. Those are hardcore topics that are always asked in the exam, and they are the ones that cannot be covered from other topics, right? So if we carry that impression that, okay, if I do pathopharma, I can do these, but it's usually like becomes a tall order to be able to get this. I mean, some guys are able to do this who are super brilliant, but if I talk about average hardworking people, they will find themselves struggling for these. So I think that using rapid revision for that would make you much more confident to go ahead and handle the topics which are mentioned on this particular slide. And I think like would not like to go into the specifics of the topics individually because that will become too boring for you guys at this particular juncture. But then yes, let's just scrolling through the topics would let you know, okay, that is this what I have read or not. And sir, can you just focus on the last slide as well? Yes. So guys, this would be 51. I mean, must know topics that have to be done very thoroughly and have to be practiced. Invest the time into the list, and I think this would make you much more, battle ready, as I was saying. Much more mentally adept at being able to handle all the kind of things that the paper is supposed to throw at us. So these are like my bits. Sorry, I've been doing too much of blabbering and talking, sir, and I have not let you speak, but now, sir, I apologize formally to the mind teacher. And sir, the stage is all yours.
No, sir, I think this is something very important and very precious you have told to the students, and I think all the students would take this opportunity and use these list of topics, for when they're preparing for medicine. Again, thank you for sharing this list as well to the students, I would say. And again, sir, in the end, I would just say, since we are in the last leg of the exam in the preparation, like in cricket, we always say, na, take one ball at a time. I always say, take, one day at a time, take one session at a time and just focus on that. Don't think too much way ahead. Don't think of tomorrow. Just focus on today. Focus on the session today and don't overthink. And again, don't get into that loop of seeing social media again and again, searching for any new update or anything else. Just focus on thing which is in your control, that is to study. Now I think,
सर
sir,
कोई दवाई बना दो ना ऐसी कि डोपामिन हिट की जरूरत ना पड़े. It's so addictive.
right, sir. It is very addictive. So make positive addiction, I would say. Maybe, take 5-10 minutes, do some exercise, talk to your family, friends, do those things which help you relax rather than, going onto the social media and getting yourself distracted. So
Sir,
final parting words from your side.
yeah. Sir, I saw a kid talking about Blinkit and then talking about Instagram.
True, sir.
Sir, 4 साल का बच्चा.
Indeed, sir. This, sir, social media and so these things, gadgets are, again, they're becoming part of our life, and it's very important, sir. That is a very different and a very important topic. We'll discuss it sometime, some other time. Children with, use of, social media and internet. So, but that is a very important, point
खाना
you
नहीं
have raised.
खाता ना सर आजकल के बच्चे जो हैं
True,
they
sir.
eat food without watching reels, right?
Right, sir. Very, very difficult. So it's important that we first control our, ourselves. Then I think that will become an
Okay.
example for the
Hmm.
kids as well. Because kids are learning from us only, from parents only, and they are also seeing things like this. So it's very important that we also try to be away from those things. Just use it judiciously, because in this era, sir, I would say very difficult to be totally devoid of those things. Very difficult, I would say.
भाई सर वो तो है. इलॉन मस्क सेज एवरीथिंग इज अवेलेबल ऑन यूट्यूब, राइट? हमें
Right.
किसी को कहीं जाने की जरूरत नहीं है.
True, sir.
कोई सा भी स्ट्रीम उठा लो, सीए उठा लो, मेडिकल उठा लो, एमबीबीएस
Right, sir.
उठा लो, राइट? आई थिंक एवरी नॉलेज, राइट, चाहे वो मेडिकल कॉलेज में जो कुछ है, आई थिंक उससे कहीं ज्यादा चीजें तो यूट्यूब पे अवेलेबल हैं. तो आई थिंक जुडिशियस यूज ऑफ रिसोर्सेज इज व्हाट इज रिक्वायर्ड.
True.
और ये मैं नहीं कह रहा, इफ इलॉन मस्क इज सेइंग इट, द गाय हु इज लाइक सीईओ ऑफ सो मेनी कंपनीज एंड इज क्रिएटेड सो मच. So you can understand if that guy says that YouTube से ही आदमी सब कुछ सीख सकता है, right? You don't need special courses for the same, because that is what is happening, right? Skill set is the core thing that people want nowadays. They don't want people who have done degrees. They just want people who are having a good skill set. So I think, sir, we can keep on continuing talking like this, but I think that our main objective and the focus was to have a razor sharp precision for doing questions, and just make every minute count, guys. Make every day count. And I think with that words, we can call the end for today's session, sir.
Right, sir. Definitely, sir.
Okay, sir. Thank you, guys. Thank you. Thank you so much for joining.
Thank you, everyone. Thank you, sir.